Dr. Moreno, how are you today, sir?
I'm doing great. How about yourself?
Doing fantastic. Thank you for being
Excellent.
here with us this morning. So, you have something excited about the pellet therapy. What is that you
Yeah, a lot
have
of people
for
have
us
been
today?
asking me lately about pellets. What are the pellets? And it's a different way of delivering bioidentical hormones. Remember, bioidentical hormones are hormones that are identical to your hormones that your body produces. But this way, it's a way of introducing or delivering the hormones in a more physiological or more natural way. And these are what we call hormone pellets. Remember, hormones are very, very important. We have to have an assessment as to what symptoms people are having and do a full analysis on the blood work. And then that way we know how much to give and what to give as far as hormones. And one of the ways we can do that is through pellets. Pellets are a sterile, compressed form of hormones that are looked as the size of rice, grain, very small, or maybe a small, like a tic tac, And what we do is we're able to introduce that in the upper left or right buttock region, and sometimes in the men it's more in the flank because that's an area where there's some fat, and we can put it right over the muscle. And what we do is we clean the area sterilely, almost like a surgical procedure, make sure it's sterile with a special type of iodine. And then we numb the area with lidocaine, and we make a very small incision, about 3 or 4 millimeters. And then we're able to introduce or slip in the pellets right under the skin, usually about less than half an inch into the skin, or right in the fat tissue, right over the muscle, or right over the gluteal region, or the muscle in the butt. And generally, it takes within 3 or 4 days, that incision is basically healed up. There's no need for stitches, just steri strips. We put like a special dressing on it so it doesn't get wet for a few days. And we just ask people not to do any heavy leg exercises like squatting for the first week because we don't want them to push them out. And what's really good about these pellets is that your body develops capillaries, like little blood vessels around the pellet, around this little rice grain, And what happens is your body starts just releasing or getting the hormones as it needs it, So it's like a little storage of the hormones. And in these pellets, we're able to put estrogen, progesterone, testosterone, and estradiol, which is an estrogen blocker, which prevents testosterone from converting to estrogen. So it takes away the need from having to take pills, gels, injections, and it's very convenient because people can travel and they don't have to travel with creams. They don't have to travel with like needles or syringes or vials of testosterone. So we can do it for both men and women. So it's very, very convenient for the very active type person that, especially if they travel or if they just don't like needles. The problem that we generally have with creams is that sometimes, unfortunately, the pharmacies, they kind of like sometimes cheap out and use a type of base on the cream that's not very good, and sometimes the cream doesn't get absorbed, so it's sometimes inconsistent. So, so that's why I typically do like these pellets. I usually have the patients try out hormones first to see if they like it, the cream or the injections or whatever. And then they do, and they do well, then I switch them over to the pellets. And it's very convenient. It's only like 3 times a year we put in the pellets. Usually the pellets last in women about 4 or 5 months. In men, it lasts a little longer because we're able to put more pellets in there because they require more testosterone, more milligrams, and they last a little longer. In women, you don't need that much testosterone, just a little bit of estrogen. In men, you require usually about 4 or 5 pellets. In women, it's just like 2 or 3 pellets. And again, for men, it's around anywhere between 4 or 6 months. In women, every 3 to 5 months. They're generally close to about 3 times a year. But in women, usually the cost is about $300 to $350. In men, it's usually between $500 and $600. So the average, usually around $550 for men. And again, what's good is that you don't get these peaks and valleys, up and down with the hormones. Once the body develops the capillary flow, the body once it takes about a week for it to come up to a good steady state. And then once that happens, it just stays like this. So it's like not usually some people can feel when their testosterone is coming low after an injection. Usually it peaks around 3 or 4 days and it starts coming down after 4 or 5 days. And sometimes it doesn't last a full week. And some people have to inject themselves up to twice a week. So it's very inconvenient, very painful. Sometimes it get infected. So with the pellets, it's very nice because people just feel consistent level all the time. I typically like to check the levels after a month on the first insertion to see how they responded to the hormones on the pellets to see if their levels are good. I also like to check them right before the next exertion. After, and most people can tell right away when their pellets are starting to wear out because all of a sudden they start feeling it. Hey, I'm tired, I'm fatigued, I'm not having the libido, I'm not as strong. Just a lot of different things that normally they had when their hormones were low. So this almost forgets people are able to almost forget that they're on hormone therapy. And for women, it's very good too because most women end up having to put these creams on for the hormones, and they get kind of messy, and you can transfer them to your kids or to your loved ones, with the screens, Sometimes they don't dissolve all the way or they don't go through the skin. I have a lady who she came to the office and she was complaining about acne and hair loss, and she couldn't understand why all of a sudden, she was having a hoarse voice. And I checked her levels, and her testosterone levels were super high. And I'm like, "Are you on testosterone?" She said, "No, absolutely not." So she tells me that her husband was on a testosterone cream, and she would work out in their gym in their house, cardio equipment, weight equipment, after he had put on his cream in the morning, and he would work out after he put on his cream. So when he sweated and he used the gym equipment, he left some of it in the equipment, even though he did clean it a little bit after he was done. She managed to get some of that transferred to her. And in her own house, her own husband's testosterone, she was getting it. And it doesn't take much for women. So just an example how some of these things can happen with creams. Now, with hormones, you always want to stay away from taking hormones orally, like in tablets or oral form, because it goes through the liver. And when the liver has to process these hormones, it disrupts clotting factors, and it can put you more prone, especially if you have a family history or you smoke, or as you get older, puts you at really high risk for strokes, heart attacks, or blood clots. So I typically stay away from oral formulations of hormones, especially estrogen and testosterone.
What are the typical symptoms that you say, okay, your hormones are imbalanced, that you say, okay, we got to do a blood work, we got to check your hormones?
Yeah. Most of the ones that we always see is I see a lot of people that they're not losing weight, they're just putting on the weight, and they're pretty adamant that they're not eating more than what they normally eat or anything different, or they're exercising and they're getting very frustrated, or evident that somebody's under a lot of stress, or they're going through the, early changes, either perimenopausal, or men are going through a little bit of a midlife crisis. It starts happening, believe it or not, in their 30s, and it slowly starts tapering down, and people start feeling it nowadays in their 40s. And they just, they're losing muscle mass. It's harder to put on muscle. They're developing more fat. Sometimes the weight's the same, but their body composition is more fat now, than muscle. Typically want your, for the average person, your percent body fat less than 20%. And we got people running around 50% body fat, and those people need hormones, So usually that there's an imbalance somewhere, either with estrogen, testosterone, thyroid, or adrenals like cortisol, because everybody's under a lot of stress. But that's one of the ones that people don't realize. But the most obvious ones, the most common ones are loss of sexual function or libido, problems with erection in men. Women are having vaginal dryness or painful intercourse. Those are hot flashes for women. The big one is insomnia. People can't, shut their brains off. They're just like really, really wired and can't sleep. That's usually an indication there's a problem with hormones too, either thyroid, cortisol, or even sex hormones. So those are the big ones. And one of the ones that people don't realize is that most people remember when they were in their 20s or even early 30s, they could just remember stuff. They had photographic memory. Everything was like sharp and you could focus. That also implicates hormones too. As you get older, if your hormones start getting out of balance or they start getting deficient, all of a sudden it also affects your hormones, affect your brain. The way your neurotransmitters are processed, and it can cause problems with memory. So right now, there's a big studies that are showing that women that have early onset Alzheimer's, usually women that are very deficient in estrogen. You give them estrogen, and their memories and their brain function improve because estrogen helps boost acetylcholine, which is one of the neurotransmitters in the brain that helps with memory.
Doc, you mentioned that these hormone pellets, what is the other name?
Well, bioidentical is basically all of the different types of hormone ways that you can give hormones. Bioidentical is the actual type of hormones that we give, and the ones that we give are basically hormones that are 100% natural. They're usually extracted from like plants. It's a plant sterols, very similar to the male or the human makeup. The problem is that a lot of these pharmaceutical companies, they put a little bit of a side chain, or they make it different so they can patent it and they can make money off of it, but that's not necessarily good for your body. And right now they're promoting these bioidentical hormones in the oral form. They think, because it's more natural hormone, we can give it orally. But don't be fooled by that. A lot of the studies are showing that even if you give it a bioidentical, which is not a synthetic, like what women used to be on a lot is Premarin or Provera and all these things. These were synthetic. Actually, there were hormones coming from a pregnant mare's urine. That's where they were getting it from, and they were putting it, encapsulating it, and using it, and patenting it, and that was very, very dangerous. They showed on the Women's Health Initiative studies back in 2002 that it was definitely very highly associated with strokes and heart attacks. Mm-hmm.
Doc, you mentioned that the hormone pellets work for male and female. What are some of the common results you see on females?
For females, they're especially females that have been very athletic. They tend to get very low on testosterone later in life. And all of a sudden, man, they feel like they can run a marathon. They feel like, hey, I can get back in the gym and I'm able to put on muscle and I have all this energy. And all of a sudden, they're like, I'm chasing my husband around the house. So it does make a huge difference. And it happens within a week. Some people, it takes a little longer, up to 2 weeks. But once your body starts just taking the hormones out of the pellets because of the capillary, the blood vessels that are formed around the pellets, it's more physiological, it's more natural delivery, because your body's just constantly getting small dosages of the hormones, not big dosages like you do in a shot. So that's why the shots, you get real good for the first 3 or 4 days because you get a big boost from the shot, but then it starts coming down, and people don't like when they come down. Sometimes they do less and they increase it like twice a week. Or there's people who are injecting now into the skin, which is very painful too. I mean, it's not that painful, but it can get infected because it's slower release. But I think the pellets are definitely a good option. It's not for everybody, It's still a small procedure in the office. It takes like less than 15 minutes to do the procedure. The worst part is actually the numbing of and I usually put a little bit of a dexamethasone, like a little steroid, very small dose, so it prevents inflammation when we go in with the lidocaine and pain. And a lot of people don't feel it that much,
Hey, Doc, you just said that pellets are not for everybody. Who specifically are the pellets for?
Yeah, the pellets, I mean, to be honest with you, they're for everybody. But just some people don't want to actually have a little procedure or a cut in their skin, and they want to either do the injections or the creams. Again, I shy away from the pills, the oral, because when you give a hormone orally, you have to give really high doses to overcome the effect of the liver, basically processing the hormone. Like normally, if you give progesterone orally, you have to give 100 milligrams. But if you do it through the skin or through a pellet, it's only 10 milligrams. So it's a big tenfold difference, And I think it's less. You end up giving less hormones, a lot safer, better delivery.
Doc, early we covered the common benefits, or you mentioned the common benefit for females. What are some of the common benefits that males will get out of these hormone pellets?
Oh, the men usually get, again, they get more muscle, more strength, better erection, more libido or better sex drive. Those are the typical ones. But they also in men, they're able to lose a lot of this belly fat. They get that little beer gut, and usually that comes from low testosterone and high estrogen. When men start getting their testosterone converted to estrogen, and that puts on weight here. So testosterone is very important for for fat loss, muscle gain. It's very important for also improving your bone structure, strength on the bone structure. And what I've said like before is these hormones will prevent you from becoming a 70 or 80-year-old man that's very frail, that's very weak, that looks like, hey, that guy looks like he's delicate. If he falls, he's going to break a hip, or if he cuts himself, he's going to have a huge cut. So basically, this hormone therapy is just to prevent people from breaking down and being an active 80-year-old. Most people nowadays are able to get up to 80 with all the advances in technologies and medications. But you want to be a vibrant, active 80-year-old, one that's still golfing or bike riding instead of just at home in a wheelchair or a walker.
Doc, what are some of the long-term benefits of hormone pellets?
Well, it's just like I said, it's very similar to just what we do with all types of hormone therapies, except that just with the hormones, it's just more convenient. It's very convenient. For example, with women, when we give them the hormone cream, usually that cream has like 3 hormones in it: progesterone, testosterone, and estrogen. And it's not cheap, because most insurances don't cover bioidentical creams or hormones. Typical cost is $50 up to $80 a month for the cream. So if you multiply that out, it's very much cost effective, even with the pellets, because the pellets are about $300 every 4 months. Ideally, some women are able to get it just twice a year. So that's almost the same cost as doing it through the cream. And you don't have to go to the pharmacy every month. You don't have to put on a cream every morning. And you don't run the risk of transferring that cream to your loved ones.
As a doctor, why you like these pellets so much?
I just like them because they're just very convenient for the patient, and it's a very easy procedure to do at home. I mean, not at home, at the office, and it's just people have them and they forget that they're even on hormones, and they're very just convenient. People don't have to worry about traveling with all these creams, or nowadays you go into like TSA, they're checking at the creams. Are you taking too many creams, or like are you taking syringes and vials and those kind of things? So it's just more convenient. But in general, I like hormone therapies whichever way, like either shots, like the creams. Just stay away from the oral hormones.
What we haven't asked you that we should know about hormone pellets?
It's very important. Unfortunately, we've had people who have had bad experience with pellets because they've gone to places where they put too much of a dose. And once you put the pellets in, you can't take them out. So if you put the wrong dose inside the patient, that's the one disadvantage that we have with these procedure is that you're kind of stuck until the effects run out, like up to 3 or 4 months. So I've known other facilities that have given too much estrogen, and women may have a lot of bleeding, in their period because they did too much estrogen. And that's the biggest one that I worry about. So that's why it's very important to make sure that the patient family history is safe to take hormones, and you got to make sure you do the appropriate blood work with the full symptom analysis of the patient to know exactly how much you're going to put in that patient. It's not like it's a simple formula, and that just comes with time, with experience with these things. And at New Age Medical, I've been doing this for about 20 years, so I feel very comfortable. We've had very good success with them. So that's a very good question, a very good point that a lot of people don't realize. These pellets, you got to know what you're doing.
What do ultimately you will like people to get out of these hormone pellets, female or male?
No, I mean, what I do is I just want people to be, to feel like they're in their 20s or 30s, and not have to worry about doing all these things. Because I know people that they like the hormones, they like the creams, they like the shot, but after a while they get fatigued. They get tired of putting the shots. Oh, doc, every time I put the shot, it's starting to hurt. Now I got to put it in my butt. Now I got to change it over to my shoulder. I got to do it on my leg, And the women also, like, they start, like saying, I don't know where else to put this cream, or it's messy, or I sweat. and it comes out, or sometimes it has a particular smell too. Sometimes the cream, and they don't like the way they smell with the cream. So it's just another avenue or another option for people that are on hormone replacement. In general, still, it's the same for anybody on hormones. The benefits are the same. More strength, more mental capacity, more sexual function, better metabolism. Easier to lose weight. Just overall, as long as everything has a risk. But like I said, you just have to monitor these patients. Like when I do my pellets, I like to check them a month out to see where the hormones have peaked, to make sure that we put enough. And if we didn't put enough, then the next time we put a little more. It's always easier to go up than to come down. So I always like to start slow. Unfortunately, a lot of places, they put high doses, and then the patient's like, oh, wired, or it's too much, But unfortunately, once you put those pellets in, you can't take them out. So I like to go slow and check them at a month, and maybe 3 or 4 months later, like before the next exertion, before we put the next one. And that way we get an idea of how often they need them and what dose. So that's crucial. And that's only in the beginning. Once we get that, then we just do blood work every 6 months, Yeah, like I said, just be very wary about these new therapies that are supposedly pharmaceutical. Because now the pharmaceutical companies want to get into the business of the bioidentical, because they realize that the people, that's what they want. But they can't put a patent on it anymore. So they're trying to do it through pill forms. They're telling people it's okay to take these pills because they're natural. But again, just be very wary about that, because orally is never good. It's not good for it to go through the liver. It's not physiological. It's not natural.
It's not natural. I love that one, Doc. Doc, I know you have a busy day ahead of you. I don't want to keep you any longer than you have to. We are up about the 24-minute mark. You deliver amazing, useful information about home pellet treatment. Again, if there are any questions, I'm going to make sure that you get them so you can answer them for the people watching live or the replay. Again, Doc, there are no more questions. Anything else that you would like to add?
No, I like your Christmas with your sweater.
Yes.
It looks good. I like it. It looks good on you. All right. Thank you, Benjo.
Thank you, sir. We'll see you again in 2 weeks. And Thank you for everybody watching. Again, leave your question. If you have any questions at all, feel free to send a message. Visit newagemedicalcenter.com. And then we'll see you live in 2 more weeks.
All right. Thank you. All right.